Hello everybody, and thank you for watching another episode of Ask Dr. Bob. And we are at the beginning of the middle of the summertime. It's the 4th of July weekend. I don't want to date this, but it is an exciting time. And I want to answer some questions about summertime cooking. And we have a lot of questions today. We thank you for all the questions. What should you do over the 4th of July? What should you eat? Well, I'm going to tell you. Just one very unique thought. Do vegetables. Cook vegetables on the grill. I happen to have kind of like a wok that has all these punched holes in it. Get some broccoli and cauliflower. Warm them up on the grill and then get that grill hot and throw some olive oil on it. That's going to add a little bit of flavor. Throw some fresh herbs at the end like cilantro or basil. And just those two vegetables alone, broccoli and cauliflower on the grill as a side versus maybe having a potato or potato salad or macaroni salad. I have nothing against potato salad or macaroni salad. And as a side note, if you're going to make macaroni salad, try some rice pasta. Grilled vegetables will go a long way. We have many questions to talk about today. And someone wrote in reference to the daughter when she was 16 years old. She was diagnosed with PCOS, which is polycystic ovarian syndrome, and they put her on the birth control pill, and she's having challenges now. What I have found from my experience, this is very common by the way, it's lack of iodine. 72% of you watching me right now don't have enough iodine. I take 12 milligrams of iodine every day. Your ovaries need iodine. The mom went on to know and said, should she go off the pill? I would take her off the pill. In my experience, the birth control pill really can create havoc. It can create liver distress, hormonal imbalance, B6 deficiencies. We had another question. Prostate in my husband. He's having an enlarged prostate. What should he do? Minimize soy. There's an item, a product called calcium D-glucarate. This is very important, by the way. Calcium D-glucarate will help clear estrogens out of the liver. So if you're a female watching me right now and you have enlarged breast, tender breast with your menses, or a heavy menses, calcium D-glucarate, 2 or 3 a day. B vitamins, B as in Bravo, anywhere from 3 to 6 a day. Milk thistle, 3 or 4, maybe a day. If you start to notice some shoulder pain with the milk thistle, start with 1 or 2 and go up to 3 or 4. For the gentleman that has an enlarged prostate, you have to follow that same protocol. Calcium D-glucarate, milk thistle, B vitamins, eat broccoli. They will take a man's prostate out and they will do ablation to a woman. Ablation is when they cauterize the inside of their uterus so they won't have a heavy menses. It's almost ludicrous to me that the medical community will burn the inside of a woman's uterus. It kind of takes me back to the leech days of putting leeches on people to suck the blood out. It just really makes me angry. Dr. Bob, what are the best foods for colitis? Eliminate dairy and gluten. Dairy and gluten will irritate your colon. I'm having more patients, more practice members come in that have a fructose or fructose sensitivity today also. It has a lot to do with their pancreas has been overburdened. So you don't realize, and maybe you do, that if you eat a lot of processed foods, your pancreas has to create more enzymes to process the processed foods. Processed foods are dead. Your pancreas has to work harder for that. So I would eat maybe a cucumber, sliced cucumber with your meal, some tomatoes to give you some fluid. You want the least amount of stress to your pancreas. Okay, somebody asked me a question about they live close to a golf course and the airborne dust and estrogen, and their house is extremely dusty. I'm going to tell you right now, they spray golf courses with herbicides and pesticides that have a lot of high estrogen in them. I'm not telling you to move, but if you could, it's not a bad idea because you're looking at breast cancer and possibly prostate cancer. For sure you want to be doing the calcium D-glucarate. I would actually maybe invest into an air purifier. You might want to have your urine iodine tested. You might want to have your urine estrogen tested. It's called Estrogen. You can contact our office. This is serious stuff. And calcium D-glucarate would help. Calcium D-glucarate helps get rid of the toxic estrogens in your liver. Someone wrote about blepharitis. Do you ever wonder where they come up with these names? Blepharitis. It's irritation of the eye. Now, dry eyes, lack of iodine. Blepharitis, I take a product, and I'm not here to pitch you on products, I'm trying to help you. I take a product called Agricept, Agricept L. I take 10 drops a day, and I've been doing it since 1996. Now, Agricept L is a citric seed extract. It's in a little bottle. You can take 2 or 3 drops of this, put it in some pure water, and put the water, so you put 2 or 3 drops of Agricept in a couple ounces of water, get a dropper and put it on your eye. That'll help get rid of the infection. But why did you have the infection? Well, it could be you're doing too much dairy, you're doing too much sugar, because I can tell you that'll weaken your immune system. Dr. Bob, what do you know about the Zytoscan? I want you to know that we use the Zytoscan dozens of times every week. It's phenomenal biocommunication. It's been very interesting for ourselves. I actually have created a few software programs for it myself for our patients. It's been very uncannily accurate. You have to know how to interpret it. To give you an example, I had a gentleman that came in the other day that had high phosphorus, high muscle, cortisol, and ghrelin. That happens to be in a detox Zytoscan that we created. And I kind of looked at him, and I think it had high arsenic. And I said, if I didn't know any better, I would have thought you just had an apple fritter or something. He had this big old grin on his face. His wife was elbowing him. He had a chocolate-covered donut. I apologize for not being totally accurate, but the phosphorus is being, your muscles are cannibalized with sugar. Phosphorus is a byproduct of that. Ghrelin tells me that your body is hungry. Trans fat increases ghrelin. Anytime that we see ghrelin on a Zytoscan. And I want you to know that we can literally send you a cradle anywhere in the world, and you can tap into our software and we can do an assessment. We have a weight loss detox Zyto software. Okay, we had an individual who had their thyroid removed. And that's quite a scary thought. And they had radiation, lots of stuff happening. What we would do, if you make the wise decision, because you happen to be someone local, we would do some blood work to you. A TSH, a T3, a T4, and a TPO. Those are blood tests that we do for thyroid. A TSH, a T3, a T4, and a TPO. We use Biotics Research Corporation. They have some products. One of them is called GTA and GTA Forte. That would help your body do what it can to make your thyroid gland operate functioning normal. I would also suggest that you may want to have your urine iodine tested. I take 12 milligrams of iodine every day. Dr. Bob, what do young females that have too much estrogen at the end of the cycle, not enough progesterone? The young female probably has a liver that's being overworked. It's interesting about we have all these estrogen questions this time. Their liver is being overworked because they're a young female. She probably has tender breasts and a heavy menstrual cycle. Listen to this little nugget I'm going to share with you. That person needs iodine because your ovaries make progesterone. I'll say that again. Iodine will be used by your ovaries to make progesterone. I want you to know that sugar will deplete your body and you're going to have higher estrogen because sugar takes B vitamins out of your body that helps process the estrogen. So let me kind of give you a little scenario and action steps here since we had so many of the same questions. High estrogen means compromised liver. If you cry easy, you need B vitamins. B vitamins process estrogen. We use a product called calcium D-glucarate. That takes estrogen toxins out of the body. You may want to try milk thistle, Levitrit's another herb. I personally take 5 drops of dandelion root in 4 ounces of water every day. And I also take peppermint leaf the same. So I hope that helps. Somebody asked me a question about the blood type diet. I happen to be blood type A. I can tell you that I've done a little bit of research. I've read other people's opinion about it. They say it's about 30% effective. I know that everybody responds different. I happen to be blood type A like I just mentioned to you. I know that if I don't watch what I'm eating, blood type A have challenges absorbing calcium. I'll get cold sores, so I make sure I take L-lysine. So I would read through the book. You're going to get some information. You know, don't base your whole life on the blood type book, because I can also tell you through Zyto scanning and food allergy testing that most people have food sensitivity to the food they eat the most of if they have digestive distress. How do you know if you have digestive distress? Have your carbon dioxide tested. A low carbon dioxide tells me you have inflammation in your colon. Whew, a lot of stuff. Are there any, this is the last question, are there any specific foods that you believe are in good favor during the summer months. I actually had conversation with my wife about this. People in Florida use citrus. Citrus cools the body down. Root vegetables warm the body up. So during the season, you want to focus on foods that will cool the body down. I don't promote citrus, by the way. It causes fibromyalgia, and I don't promote watermelon. It'll cause left neck and mid-back pain. I do promote cucumbers, though. Cucumbers would be something you'd want to add during the summertime. You want to give your body the least amount of heavy protein. Like, I would not eat a lot of beef, and I would not eat turkey breast. They're a little bit more challenging to digest. Okay. So I hope that you learned an awful lot from this, and I really appreciate everybody and all of the different questions that we get. But recently we did some information about fibroids and this female hormonal issue. What I want to do next week is we're going to talk a little bit about the release of my female hormone book. It's going to be released July the 8th, brand new version, over 800 editions or edits and changes, new updated cover. And we'll talk about estrogen because I know that's on everybody's mind. You all have a great 4th of July. Please pass this on. We love and appreciate each and every one of you.